40-year-old Angie Holmes loves going to work. Her office is anything but ordinary.
I've worked at the Fort Worth Zoo for 15 years. I am a gorilla keeper. I feel like a gorilla waitress. I cook, I clean, I put the food in, I take the food away, chop their diets, do the training.
As you can imagine, her job is physically demanding.
I'm opening doors where our doors weigh anywhere between 60 and 70 pounds, just moving the gorillas from area to area. I first started noticing issues with my right hand a number of years ago. Tingling, a little bit of burning. At work, it became an issue because obviously strength in my hands and my upper body is really important. At home, it was things like eating, going out with friends, and having my arm at a certain level. My hand would fall asleep mid-meal.
And I'd like you to tell me if you have any tingling.
Angie sought the help of Dr. Timothy Nakaris, an orthopedic hand surgeon at Texas Health Hand and Upper Extremity Specialists, a Texas Health Physicians Group practice.
Angie first presented to my clinic complaining of numbness and tingling in her right hand. This numbness and tingling had become so severe as to affect her daily activities.
After closer examination and testing, Dr. Nakaris discovered the culprit.
She had findings very similar to many patients with carpal and cubital tunnel syndrome. One of the signs we look for is irritability of the nerve that we can tell by tapping it. This is similar to what happens when you hit your funny bone, but these patients have a much more pronounced response to this.
Non-operative treatment provided only temporary relief. Surgery was needed.
We decided to do surgery both at my wrist and at my elbow, and we decided to do both of those simultaneously.
One of the things she was very interested in was the fact that I offer an endoscopic, minimally invasive carpal tunnel surgery. The reason this was important to her at the time is that she really wanted to get back to work as soon as possible. We were able to perform a small incision at the wrist and use a camera to release the ligament that presses on the nerve. This causes the nerve to have increased blood flow and helps it recover. We do a similar, although slightly different technique over the elbow.
Post-surgery, things were great. I did choose to go to occupational therapy because I wanted to get back to my job.
Many patients don't need formalized hand therapy, but this helped Angie get back to doing the activities she needed to take care of large animals at the zoo.
My life now is great. Back with the animals. I'm able to be fully engaged in all of their care. With driving, it's not uncomfortable anymore. I can go on road trips and not have my hands fall asleep. Bringing groceries in, my husband loves it. I can do it myself. I would definitely recommend Dr. Nakaris and the Texas Health Hand and Upper Extremity Specialists. They changed my life. He's an amazing doctor. He listened to what I had to say. We made a plan together. His staff was super helpful. The future looks bright. I am happy at work. I am able to do my job. I'm able to participate at home. I'm able to do activities that I enjoy. And I really look forward to being able to just move forward and see what life has to offer.